The New England Journal of Medicine research indicates that 95% of monkeypox cases have been transmitted through sexual activity and 98% of infected people were gay or bisexual men. The World Health Organization (WHO) has urged this demographic to refrain from having multiple sex partners to help slow the spread of the virus. Some have criticized the appeal, labeling it as homophobic. Officials explained that the virus is prevalent among this group of people at this stage of the outbreak.
What we found is that, despite the fact that that there are these several modes of transmission, it seems to be very efficiently passed on through sexual activity. And this sexual activity could have been with any group of people, but it's found its way into networks of people who are connected because they are having it is sex between men essentially. So bisexual, gay men, other men who have sex with men are at the moment mostly affected. So we're seeing figures from Europe and elsewhere that 99% of cases are within this group.
But WHO officials during a Q&A session this week explained that monkeypox can affect anyone. However, the recent advisory was intended for community leaders to help take action to bring the outbreak under control.
That doesn't mean that this is in any way a disease that is just for that community. So we absolutely have to separate out the community and the action, if you will, so the behavior. And already we're seeing for some time, we've seen communities taking great leadership in helping get messages across around prevention and really trying to be on top of this response.
The need to make health advisories more impartial was also noted.
It's really important that we balance our messages. So we have heard this, as you say, we have been asked about, is it homophobic to expressly describe what we're seeing? The answer is no. We need to direct resources to where we're seeing cases, and at the moment it's in those communities that we've heard. We've also heard at this conference that we need to slightly expand our understanding and definitions to also include some trans people who are also within that sexual network.
The WHO stresses that monkeypox can be acquired through any kind of close physical contact. However, research suggests that most transmissions have been related to sexual activity mainly. Moreover, there is some evidence that indicates that the virus can be transmitted by contact with respiratory droplets, clothing, or other surfaces. Gina Filippi, HDS News Force.